I'm going to be talking about the adult nursing and obviously their roles and responsibilities. Basically, as you can see, there's a lot of about 300,000 adult nurses in the UK at the moment, and you can see there there's 59% of adult nurses. Excluding midwives, adult nurses, they tend to choose certain areas, like you've got adult nursing, you've got child nursing, and then you've also got mental health nursing. So basically they will have different roles, but they will start from the beginning, for like first year, they all start at the same time, and then after like second year, and they will kind of like, go to their specialized roles. So basically what the adult nurses do is a trained nurse who look after like vulnerable people with acute or chronic illnesses, and also they tend to work alongside with people. Their roles is basically caring and recording information, policy deliberation, counselling, training, patient advocacy, work managing, teaching, research, promoting, and also improve the quality of the patient. So basically what care it means is basically providing the needs for a resident. And sorry, I'm going to say, obviously I work in a care home, so I'm going to be using a lot of resident rather than patient. Alright. So basically care here means providing quality of care to the residents. That would be one of the roles. And secondly, recording information is about basically, writing anything down that they find out about the resident. For example, first time when they come in the care home, like I said, I'm going to be talking about care home because I work not in the hospital, so I know more about the care home. So basically, when they come in first time, they will be taking information from the residents and the relatives. So they will write in care plans, and those care plans will require their mental capacity, the medication they're going to be taking, their mobility, and also their nutrition, plus the skin integrity. We now have nurses where basically they are training people with pressure ulcer training, like tissue viability nurses. So we have nurses also like managing care homes, like units. Nurses will run like maybe dementia unit or residential unit, or even a nursing unit itself. So we have nursing as well, teaching as well, they'll be teaching students in the universities and also in the hospitals. So we have nurses doing research as well about finding more cures to current illnesses. Nurses' role, like I said before, basically is about writing care plan, assisting patients, when needed. Obviously, they have like a sort of team where they, like the people that they work with, like carers. So basically, they would also write their part in working alongside these carers, helping the residents on their part, with their personal hygiene, feeding, and all that sort of thing. And again, like writing care plans, implementing and evaluating care plans when there's changes in the resident's condition. They will do evaluation to making sure that it's up to date. Monitoring patients' health, like taking blood pressure, making sure that the residents are not they do not have high part or hypo, for example, diabetes, people with diabetes. So they will be monitoring and checking the vital signs of a patient to make sure that they do not have any, what would I say? They do not have illnesses that they're unreported. Nurses work with a lot of people, and they are in the centre of a multidisciplinary team. So as you can see here, the approach involves guiding appropriately from two or more disciplines to explore problems outside of usual boundaries. So this means that nurses are in the centre of the multidisciplinary team, working alongside the doctors. Basically, what that means is that if a nurse is looking after a patient and if there is any concern with the patient, they will call the doctors to get an information about what the next step is or what the next stage is. And also with the physiotherapists, for example, if a resident in a care home has fallen or has an injury or fracture, basically when they come back from the hospital, they will involve the physiotherapist to come back, to come out and assess them with their mobilities so that they're not bedridden. Occupational therapy, like the OT, is the same as the physios, exactly. Again, and also you have the pharmacies. The nurses will contact the pharmacies about the medication that a person is taking and also about their side effects. So all these are involved in the care plan as well. They will make sure boundaries. I've mentioned it before. Obviously, professional boundaries, as you can see, nurses need to be aware, be cognizant of feelings and behaviour, be observant of behaviour of other professionals, always act in the best interest of the patient. So what that means before I sign it, like I said before, in the care home, you would see a carer who would say that that certain person is their favourite. So when that happened, you see like a resident then started to choose that person to do everything for them. So which means that they stop other people helping them. So that's why a lot of times people don't realise that they are crossing boundaries, and these boundaries do not be crossed because when that sort of thing happens, residents tend to choose people to do things for them. As you can see here, the therapeutic relationship, a zone of helpfulness, which again people have mentioned before. It shouldn't be under involvement or over involvement. It should always be the zone where everyone or every resident get equal treatment from everyone. And again, policy and politics, legislation and ethics. As you can see here, the 6 C's. Energies I've got like obviously now is a 7 C, not 7 6 C's, but 7 C's. Care means providing the care that for the residents that require. Compassion, to be empathetic towards residents and their families, and competent to making sure that they are competent in what they're doing. Communication, making sure that they communicate with patients regularly and making sure that they are involved in their care. Courage, they are also to make sure that they have, they act accordingly, and if they see anything, to report it. Commitment, to be, like making sure that they are committed to their job and making sure that they are doing it accordingly. And the NMC code, the code of the NMC code, basically prioritising people. That means that people shouldn't choose who they treat or like based on their gender or sex or where they come from. So they should make sure that everyone is treated individually, practice effectively, making sure that they communicate with residents. And those is always should make sure that patient come first and they communicate with them and making sure that they are involved in their care. Result safety, making sure that nurses are always willing to help, especially when the residents are in like palliative care and things like that. They are always there to, willing to help them. Promote professionalism and trust. That means is basically nurses act, accordingly under these the NMC code, that making sure that they promote the role. Safeguarding, as you can see here, I've chosen 4, is identify safeguarding concern. For example, like I said, again in care home, if there is unexplained bruising, or a resident, for example, has maybe an accident, or there was something else involved where staff has seen this, but obviously they weren't sure where it came from, they should report it to the line manager. And again, report the concerns all staff involved, nursing, midwives, healthcare assistant, and this is using the organisation and the policies. This will be in conjunction with the agency. Participate in inquiries, deep breathing, and reflect. So basically on the outcome. For example, if you are reporting something to your line manager you want to, like, find out if they dealt with it or not. But majority of the time you see the CQC community care homes because they have to report this to you. For example, if there's a safeguarding issue, they'll report it to CQC to come out and investigate them. So that's why it's always important to have safeguarding in place. The legislation, basically, on NHS, Article 15 of the Nursing and Midwifery Order 2001, this required that training, all staff are trained to the standard required. And the next one is the NMC set up standard of proficiency required to admit to each part of the registration for safety, effective practice on the part of the register. The ethics. There's so many of them, but basically I've chosen 3 of them. Autonomy, which obviously allow residents to choose or have the freedom to choose, like, to be treated or to refuse treatment, and confidentiality, making sure that they don't share patients' records with other people unless required. Duty of care, that everyone has a duty of care to act when they have observed, unsafe activity. And again, the society expectation of nurses, as you can see before, previously nurses used to be called angel of mercy, the doctor's handmaid, and patrons, and sexy nurses. But nowadays, obviously, as you can see here, these have changed. Nurses, what people see in nurses, like what my friends think I do, what my mum thinks I do, like what the society think I do, as you can see on the audio. But they don't realise that nurses are actually doing all of these, or like majority of these. So that's why you're seeing what I actually do. Okay. Again, the stereotyping of nursing, like you all said before, there is only 10% of male nurses in the UK, as you hear. What the society think of people, the nurse, male nurses are all gay. And also you can see here, they think that a male nurse is a second sex in the in nursing, or nursing, So after some research conducted by Callis, the image of nursing in the media corresponds to 6 different periods, but these were like the years, like, it's basically like every time the nurses are given a name. So from 1854 to 1919, sorry, that was 1919, they were called Angel of Mercy. So from then on, they would go Girl Friday, the Heroine, Mother, Sex Object, and now they're calling them the Careers. So as you can see, the changing names and then the stereotyping still continue. And again, male nurses, there is not many of male nurses in the nursing industry. So again, my survey, when I ask people, a lot of people, I ask them about what the society think of nurses. They say they promote care and support patients, which obviously now is changing. Before, they wouldn't think that, because they think that society actually think that nurses work for the doctors, or like doctors handmaid. And again, I asked about the foreigners, and 69% agreed that they were treated by foreigners, and 62% agreed to be treated by male. So again, there's still changes, but it's taking a bit of time. And crisis in nursing and men are the solution. Again, like I said, as you can see here, 33% drops in scrapping of bursary. Not a lot of people are not involved in nursing. Scotland and Wales still offer bursary, but they're struggling to recruit nurses. NHS now, they're spending about 64,000 a day on nursing agencies, and in the UK 90% are, like I said, female and 10% are male. So in time, if more males are involved in nursing, all these shortages or spending 4,000 a day would help cut all those down. And like I said, one study has said that nurses now, male nurses now feel like they're part of the team, and even they feel like they're more